I'm so glad to have you with us for another inspiring episode of You Were There. I'm your host, Madupe, and it's such a joy to be your guide through today's lineup. Get ready for incredible stories of change. Meet the change makers and the lives they've touched. It's going to be an amazing trip in today's episode. Let's get right into it, shall we? Good health is priceless, isn't it? Sometimes we don't remember the value of wellness until we lose it. Here's a question, though. What do you do when your health fails? Do you take a trip to see the doctor, or do you self-medicate? We asked people on the streets what they thought of self-medication, and here are the answers we got.
I used to do checkup every end of the month. I know they wait till when I fall sick.
It's quite far.
It's like 10 minutes drive.
Like 10 minutes drive?
Not too close.
Like 2 kilometers away.
It's a stone throw.
Actually, it's not far.
It's not that far from where I'm staying.
It's not far like that. Highest 10 minutes to the general hospital here.
I self-medicate.
I go to hospital.
I go to the hospital.
I don't self-medicate.
Self-medication, of course. If it doesn't get better, then I'll go to the hospital.
Sickness get categories. If you feel small headache, where you can take paracetamol and they calm it down, no need of going to hospital.
No, I go to hospital direct. I don't use myself to play.
Actually, I don't like medicine and I don't like going to the hospital. I have this belief that the sickness get tired to go.
Anytime I feel sick, I just assume it's malaria, so I just get malaria drugs.
It's cheaper for me, the cheaper option.
I go to the pharmacy first when I fall sick because nobody has strength for hospital stress.
If I see that I have the money and I see that the self-medication is not giving me what I want, so I will go to the hospital.
It depends on the nature of what is wrong with me. If it's something like cough, I could just get tom-tom or something, but if it's persists, then I go to the hospital.
Self-medication can be dangerous and lead to several complications and poor health. So learn to consult your doctor. But because it seems like the easier way to get well, many people still self-medicate. In the rural areas, however, the challenge is a little different. Many communities don't have access to basic health care. Thank God CBN partners have chosen to mitigate this by establishing rural health clinics in these communities. Arishi community in Nasarawa State is next for a fresh dose of health. You don't want to miss this.
Nasarawa State, Nigeria, is known for its vast and rich landscapes suitable for commercial farming, wildlife, and forest conservation. Agriculture, therefore, is the mainstay of the economy of the state. No doubt, there is abundant food here, but the same cannot be said about the quality of their healthcare. CBN, in partnership with the Japanese embassy, plans to build a clinic, and this time, their focus is Arishi. The team sets out from Abuja on this great mission. The journey may come with its tides, but reaching their destination is topmost priority.
The closest hospital from what we hear is almost 20 kilometers, if not even 30 kilometers away from here. So we thought this would be a good location to site a clinic.
For many communities like Arishi, getting good medical attention close by or within short distances poses a great problem, and solving it will save lives in cases of emergency.
Whenever anyone falls ill, we usually have to take them on a motorcycle to another village close to Arishi.
We always struggle to get help. The only place to get medical treatment is in another village. But now that you are here, things will be different.
Like every good structure, a solid foundation is first dug, and with the combined efforts of the volunteers and building workers, the clinic walls are gradually raised brick by brick. From start to finish, the long wait is finally over, and it's time to launch. Dr. Felix Usamuje, the Regional Director of CBN Anglophone West Africa, had the singular honor of commissioning the clinic and addressing the people of Arishi.
I dedicate this clinic to the glory of God.
It is a day to remember, a day of dancing, singing, and most importantly, a day of gratitude for Arishi and its citizens.
We were trained on how to attend to anyone that came into the clinic sick. I am grateful for all that I have been taught. Thank you, Operation Blessing.
Hope is finally in Arishi. Just look at the people dancing and rejoicing. They no longer have to travel miles to get medical help. Thank you, CBN partners, for making this a reality. God bless you. There's a lot to consider when establishing clinics in hard-to-reach places, but so far, CBN has been able to set up numerous healthcare facilities in these communities with the help of partners and dedicated volunteers. The Community Health Coordinator is with us today to share the successes and limitations in setting up a rural clinic. That's next on the program.
Thank you for always joining us on this segment of You Were There. This is a platform where we get a chance to chat with individuals who are helping CBN to get the job done. And today we have in the studios Dr. Abimbola Olofin. She is our Community Health Coordinator and she's in charge of our rural clinics. So today she'll be giving us updates on what has been happening so far on that zone. Thank you for making our time to be here, Doctor.
Thank you for having me as well.
Let's back up a little bit and talk about the heart behind establishing rural health clinic. How did that come about?
You know, we started with medical missions, going from one rural clinic to another, having medical outreaches for about a week or thereabouts. After we had left, they keep calling us to come back. There are needs to be met. And other people too are calling us in several places. So we felt, wouldn't it be nice to have a rural clinic established in such a community? Also, sending skilled medical personnel, many of them can't cope in such an environment where there's no network, there's no water, you know, the living conditions are really poor. So we thought about getting people that live in these communities, train them to help their people. That was how the rural clinic started.
How do you come about selecting these volunteers that you work with?
Okay, when we have a contact person that tells us about a particular community, we go to the community and find out if it's actually a hard-to-reach community. We want to know the distance between the community and the nearest government hospital. And we also ask the community members, what are your needs? Because it's one thing to think they want a rural clinic, and it's another thing for them to say, we don't want one. And we go there, we ask them, what are your priorities? We see that the rural clinic is a priority for them. They really need one. We'll tell them to select a certain amount of people for us to interview as well, to tell them what it takes to be a volunteer health worker in the community. And for those of them that are fit for the job, we then bring them out of the community and train them.
You know, it's one thing to have an intention. It's another thing for that intention to be fulfilled. So do you think that this system has been effective based on your relationship with them?
It has really been effective because, you know, something as basic as paracetamol, some of these people don't have access to it, and they use several herbs that even worsen their condition. And most times these illnesses we talk about are things that they can either prevent or can be treated. It's not something they have to die because of it. Sometimes they don't see anything wrong with drinking bad water. They don't see anything wrong with sharing the same water a cow drinks from, or people living there bathing, drinking it and cooking with it. They don't see anything wrong with it. Or they don't see anything wrong with defecating in public places, not having a proper, even if it's a pit latrine, they don't see anything wrong with it. So it's very key to get them educated, to get them trained, and they as well will go back and train their community members. So the feedback has been awesome. In time past, we heard of children dying of something that can be prevented, pregnant women going miles because they want to deliver them and stuff. There was a particular guy in one of our rural clinics. He had ulcer. He didn't really know what it was. He just knew he had epigastric pain, and he had been managing it on his own. He has been, you know, trying to either take this herb or take that herb or do one thing or the other just to suppress it. So it got to a point he started stooling blood and it was becoming uncontrollable. It was becoming inconvenient. I was like, we have a rural clinic. Let me just walk into it and see what they can offer me. And he told them, he complained to them, he told them of his symptoms, and they gave him just some few drugs. And after a while, he was better. He was able to go back to his farm. This is one of such stories we hear every now and then.
When did we actually start this implementation?
We started this 2008, and we have established 10 rural clinics so far. And we declare that the clinic has started operating from now. Some of these rural clinics, they start off initially in a one-room apartment, have their drug cabinets and see patients in that one room. The Japanese embassy has helped us with grants to build a structure, and this has really gone a long way to help us. We also have the Vitamin Angels organization. They've given us free vitamin A supplements for children between 6 months to 5 years, free deworming tablets for children between 1 year to 5 years, and multivitamins for pregnant women and breastfeeding mothers. These are all free. And they actually want us to give to children in hard-to-reach areas, in rural communities. And this has really helped our clinic, has really transformed our clinic, because you see children coming in and having these supplements and doing well for themselves in school and for their parents. And also pregnant women that don't have access to antenatal drugs, they have these drugs free, and they do well, and their babies do well as well. I want to say thank you to them.
Maybe there's someone who is watching right now and the person is inspired to say, you know what, I can build 3 or 4 clinics, so, you know, to support this cause. How much, or what's the cost to making this happen?
But you know, it takes about 10 to 12 million to build and equip a rural clinic. As in, equip means the basic equipment, not really big ones. So it costs a lot and it goes a long way. So we'll be happy if we have people that are ready to support us. It might not just be in terms of building, they can as well give us drugs and any other thing they feel they can support.
We need to establish more rural clinics, and we need the people out there to help us do that, so speak to them.
Okay, I want to say thank you to CBN Partners for how far you've helped us. You've really been there for us and providing us support and the funds we need to do all we are doing. And this is going out to as many people that want to support us. Like I said earlier, it takes 10 to 12 million to build a clinic and equip it. I know one Nigerian can do that, or as many people can come together and do that. It might not be a building, it could be drugs, it could be any other thing you think we need. Would appreciate your support. These people really need the help. Imagine children in the rural clinics, in the rural communities that might die because of something that can be prevented, or one little illness, you know, and pregnant women that go through different things during labor. But with this help, with this support, it will go a long way to eradicate so many of these. So we would appreciate your help, we appreciate your support.
Isn't that just amazing? CBN Partners don't just stop at setting up rural clinics in these communities. They go as far as training community health volunteers to manage the facility. So many clinics have been established thanks to support of our partners, but there's still a lot more to go. Your partnership is needed now more than ever. Your giving doesn't just build rural clinics, it also travels across borders to save lives. Little Hal had a poor heart condition and his mother feared the worst. But thanks to your partnership, Hal is getting the most out of his childhood. Take a look at how you brought hope to Hal.
Hao Xuan and his cousin Ming had a carefree friendship full of fun and games until Ming heard Hao had heart problems.
Sometimes if I wanted to go for a run, Ming said, "No, you can't do that. It's because Hao is my best friend and I don't want him to have a heart attack."
He got fevers a lot, so I always slept with one eye open to check on him. I was worried he would have a seizure in the middle of the night.
Seizures came night and day.
It was like a time bomb that would explode without warning. He would be doing fine 1 second, and then in a blink of the eye, he would faint. Once he just dropped his spoon and passed out. His arms and legs started twitching, and he foamed at the mouth.
Mrs. Zhao was afraid Hao was dying.
The fear was more horrifying than picturing myself dying. It was like someone was ripping my heart out, and I blamed myself.
Haoxuan's heart continued to get worse. He could never stay warm, and he caught colds easily.
My heart hurt so much. It felt like there were bad guys living inside there. My mom said I needed surgery, but couldn't afford it.
I looked for ways to make just 10 cents to put towards surgery. We were helpless.
By the age of 7, Hao could no longer go outside.
It was like the world had fallen apart and I had been cut by an axe. He was so skinny and fragile, and his heart trouble got worse as he grew because he couldn't keep up with his body.
That's when CBN arranged for free heart surgery that saved Hao's life. Now, no one can slow him down.
My heart doesn't hurt anymore.
Haoxuan has changed so much. He's taller and he weighs more, and he even helps other people. CBN's love pushed away my fear and got us through everything.
Now, Haoxuan and I can be together forever.
What a heartwarming story. Now, Hao can play and run around with his best friend just like every other child his age. He has a fully functional heart thanks to your committed giving. God bless you, dear partners. Hao is one out of millions who have received free medical help through the generous giving of CBN partners. But there's still a lot we need to do. More villages need accessible clinics, and more children need urgent medical attention. There's still communities without clean water, and we need more hands ready to give. Join us and help bring hope to these people. With as low as 2,500 Naira monthly, you can do these and so much more. To become a partner, please call any of the numbers now on your screen or sign up on our website. We can't wait to have you on board. We'll take a short break, and right after that, Favor will take us into her world of service, where she touches lives with her time. Stay with us. A very warm welcome to everyone watching. We show you life-changing stories of those you have helped through your generous giving.
I say thank you to CBN.
You provided free surgeries for the helpless, clean water wells for many communities, empowered youth, women, and widows. For more heartwarming and life-transforming stories you made happen, watch episodes of You Were There on Flame TV.
There was a boy lying hopeless on the floor. And I was like, what's wrong with you? Are you okay? He could not talk. He could barely talk. And I had to quickly call the attention of one of the doctors. After that, they checked him, and behold, he had malaria. He was so down with malaria. He could not talk. He could not do anything. But immediately, after the doctor checked him, they had to inject him at the spot. And within 5 minutes, this boy was up. He was happy. He was so excited. I was super happy because this boy was lifeless just few minutes ago, and now he's all happy. And I had to ask him, so what happened to you? Are you fine? And he had to tell me he could not go to school because he was really down. And he heard that we had a free medical brigade, and he quickly rushed down to the venue. With the last strength he had, he rushed down there. And when he got to the place, he could not talk. He just collapsed on the floor, not until when I saw him. Act of service. Service is one of the key, most important things that make people feel valued and make people feel loved. Operation Blessing go out and reach out to these people by helping them and bringing smile back to their faces. Just giving someone a glass of water, it shows act of service. We see houses that are being collapsed, houses that are being flooded with water, and then CBN Operation Blessing come up to save them, build them new homes, give them hope again, and then give them food that will sustain them. And also, CBN Operation Blessing is the best place I could ever find myself, because the moment I feed children that are malnourished, I just feel happy, because I can imagine staying a day without food. And also, people that don't even have clean water to drink, and then they drink water that have been contaminated. But CBN Operation Blessing provides these ones with clean water, and then they drink healthy water. I am opportune to go to the field to help these people out. But you don't have to go to the field just like I do. Your money can help. Join CBN Africa. Be a partner with us today.
Your efforts are nothing short of amazing, Favor. It's a powerful reminder that even a small act of service can make a world of difference. Thank you, Favor, for bringing food, clean water, and medical care to people who desperately need them. Now, let's dive into some of the wonderful feedback we've received. Your words fuel our commitment, and we can't wait to share them with everyone. Stay tuned. Today, witnessing the birth of a whole clinic for an entire community, just incredible. But guess what? The journey doesn't end here. There's so much more in store for you on the next episode. Can't wait to share more heartwarming stories. But in the meantime, you can keep in touch with us through our social media handles. Plus, for your all-day, everyday viewing pleasure, Flame TV is now available on Strong Decoder or any free-to-air decoder. You can download the Avo TV app and enjoy a stream of clean content from Flame TV. Until next time, this is Modupe saying bye for now. See you soon.